We use the education from the chronic care guidelines, so that can be printed out and given to the patients. And when we engage patients and they determine they want to work with us, and as we do the assessment for those people who are working with us, it helps us to make goals for the patients and be able to give interventions for the patients. And we have used it in our protocols because we've had to put protocols together to be able to triage the patients that have high blood pressure and being able to take steps without having to contact the doctor for every little thing. And so we use the guidelines for that too, for our development of well, not only protocols, but when we write guidelines for every program that we do, like this is the process for a population health nurse clinic. And so the guidelines are a part of the information that we use to write up our own department guidelines so everybody knows what we need to do and why we need to do it that way. We have done a lot with social determinants of health. It's been a community goal for the last 3 years for SHARP as an entity. And we've done most of our work with food insecurity. And so the goal is every person that you talk to that's a SHARP patient, no matter what insurance they have, no matter where they live, no matter how old they are, we ask the food insecurity questions, the two questions about have you been afraid that you've run out of food or have you run out of food the last, I forget what the months are. And then we put their answers in the EMR so everyone has them. And if they do have food insecurity or screen positive for food insecurity, our community health workers get a list. They work very closely with our social workers under my department, and they outreach to the patient to ensure that what they answered and how they answered was still happening, or if they had questions about it. And then some people, oh, I was in a bad way, but now I'm better. Other people are still in a bad way, and we send resources. The foundation, the people that donate to SHARP, they saw what we were doing and they made a very generous foundation for $100 food cards during COVID for anyone who screened positive for food insecurity and needed help. So we actually were able to hand out $100 food cards to many of our patients who resources enough wasn't enough. So that's been a big deal within the last 3 years. And we've been able to really share that with the offices and have them be able to document on that. And this year, our goal was not only food insecurity, but the combination of food insecurity and asking the question, do you live alone? And as the doctor mentioned today in the opening keynote speak, that loneliness is such a big problem right now and really contributes to health. And so now we have a process where we find out if the patients are living alone. And I mean, it may be a 28-year-old who's fine and living alone and wants to live alone. And usually it's a senior population or someone with a mental health diagnosis that can really suffer from living alone. But if a patient answers yes, we have some additional screening that we can talk to the patient to see, okay, they may live alone, but they have a great support system, or the daughter lives next door, the grandkids live next door, and they're okay. But it may be that there's no one, and they even have difficulty getting to the doctor's offices, and then we have a whole process in place for that also.